So this is part 2 on the shoulder. We already talked a little bit about the axial body and the shoulder girdle as far as the bones, and a little bit of the relationship between the central body or the axial skeleton and the appendicular as far as it relates to the girdle. The girdle kind of rests right on the central body, and that's quite an important thing. So as we've talked about in a different segment, the mechanics of the central body, the axial body, are quite important. We can use an appendage to help manipulate or adjust the axial body, but there also does need to be some work done on the axial body to help hold this in position for the girdle to work well. Different conversation for today. For right now, I want to briefly go over some of the muscles of the shoulder girdle, and those are going to be the muscles primarily that attach the girdle towards the torso. The big ones are the trapezius, which are going to go from this bone and the scapula up, and from basically this bone and the scapula down, the central column, and all the way up to the head. It's quite an important muscle to talk about. The rhomboids, which are going to be right underneath here. We have a levator scapula that comes from the underside of the scapula, or right up in here, all the way up towards the head. Elevates the scapula. They can also be used to pull the skull back and down if we change the position. And then two muscles that are very interesting. One is the serratus, which comes from all the way underneath in here, be on this side, and wraps around to the ribs right in here. It's a very important muscle. And the pectoralis minor, which is a small pec muscle, and it goes from this little bony process into this area of the ribs. Pec minor does do a lot of work. It initiates and stabilizes a little bit. Pectoralis major is the one we're probably more familiar with. Pec minor does some work. But a lot of times we'll see pec minor issues on the yoga mat as something that's being too tight and restrictive and not allowing the girdle to broaden or open up back. The serratus can have a little bit of some work on that as well too. Both of those are tight. Now, there is some relationship between how the scapula are held onto the back and how these other muscles in the front can work. So when we do any movement where we try to press out through the arm, that movement is best initiated from these serratus muscles that are under here. By the way, there is a small set of serratus muscle up here. It goes from scapula back in towards the ribs as well. But the serratus muscle here, a lot of times it's the muscle described as the muscle that wings the scapula off the back. It doesn't get much relationship to any work. But anytime we press, if the shoulder girdle is in a really optimal position, which is usually fairly fixed to the back with the torso upright and broad, it's a very powerful position, then we need something that's going to pull the scapula slightly broad of the spine and start to initiate the girdle to move a little bit more towards the front body to help you extend the arm. When this is done too much, we end up rounding, and we take the girdle so far off the back that we don't really have much more powerful movement through it, and we can destabilize the shoulder joint. So there's a touchy little space here. The serratus muscle that does come from underneath here, it initiates the press. It also connects to some of our core and trunk muscles from the abs, and then relates to another set of abdominal muscles. So we have our internal and external obliques as they come down and connect into the hip area. So this serratus piece of mechanics is great. Serratus, and in a different lecture, the serrato-rhomboid connection as it works. Rhomboid here, serratus here, core muscles here and here. And so we can initiate movements like pressing, or if it were baseball, like throwing, girdle coming around, torso, trunk, all the way into the hip. But when we're on the yoga mat, what happens a lot of times is we simply try to lower slowly by changing our eccentric, concentric work and just trying to kind of release the triceps slowly without doing any pressing. And when we do pretty much a tricep lowering, the shoulder girdles come off because there isn't really much integration here, and there's definitely no pressing, and you're just lowering with the triceps, and the entire girdle tends to displace forward. The downside with that is numerous. what we see to be the biggest thing that folks will complain about, not just the lack of function, without developing the appropriate muscles for a stable girdle. A lot of the poses are really hard to do without that function developed. But in this collapse, we see a lot of impingement in the shoulder, and then the two different bicep tendons that come right up in through here. One of them comes right up over here. When the head of the arm bone collapses forward, because the girdle collapses forward, then the head of the arm bone starts to lean towards the front of the body. It starts to lean exactly like this. You can't bend this elbow. And you start to put a ton of pressure right through the front there. There is also, there's two heads to the biceps, so we'll find two of these. And the second one is not illustrated here. So when we start to put a lot of pressure on that, we tend to get inflammation, potentially even a bursitis, and the girdle itself can tend to kind of collapse and impinge its space. So those little bursas, the little bursa sacs in there can become chronically inflamed, and the bicep tendons, this one primarily, can also tend to get beaten up and inflamed too. One of the first things that I would do to help rectify that would be to stabilize the girdle, not to the front portion of the body, but I would say to the lateral side of the body. And even squeezing the shoulder blades too consistently, too far to the back, stabilizing it all the way to the spine, that could even lead to some other issues, not the bicep tendon issue, but some other ones. So the shoulder girdle should rest nice and even on the side of the torso. Should have the scapula coming to the front fairly easily, or scapula going to the back fairly easily, with a little bit of anatomy to the front. Should have the collarbone easily to the front, giving you the ability to stabilize to the back and then to move and press to the front. And that pressing action, not a leaning action, should result in a little bit of core integration as well. This is something that has to be trained. It's not something that's automatic, and especially if your mechanics move the girdle off of the back and more towards the front, more dominantly towards the front, more of the scapular anatomy towards the front plane of the body. There's a lot of retraining that has to be done. First, axial body. Second, stabilization of the girdle more towards the back. And third, how to actually press versus just kind of do a slow lowering without any pressing. Two dramatically different things. All right.